Invisalign is one of the two ways to straighten teeth. So traditionally we've got metal wires and braces, but recently we can provide patients with a more comfortable solution. So that involves a clear aligner that goes over the teeth, and Invisalign is one of the more popular brands. So there are definitely cases where Invisalign's not suitable. So in cases where it's a bit too complicated for the system to work, we would recommend your traditional braces, or otherwise in certain cases where there's skeletal malocclusion, where the jaw's not aligned properly, in those cases Invisalign's not quite effective. A lot of people think that with age, that's going to be a barrier, but age is not a barrier to getting Invisalign. If anything, it will be compliance. So if you're not willing to put in the amount of time, so if you're not willing to wear it for 20 hours a day, then we definitely won't recommend that. It does require a bit of manual dexterity to put it in and take it out. So if you can't do that, then Invisalign won't be suitable. There's a wide range of cases where Invisalign can treat. So we can treat crowding or spacing, deep bite, protruded bite, or even relapse cases when you might have had orthodontic when you were younger, but the teeth has moved since then. Invisalign is suitable for that. Many patients are going for online aligner products without seeing the dentist. Now, it's important to see a dentist before you get any orthodontic treatment, just so that we can screen for any decay in the teeth, any gum diseases, or any issues might be worse when you start orthodontic treatment. So the dentist will pick up on things like decay, untreated infection, or teeth mobility that might not be picked up through these online services, through photos or impressions. If there is any untreated decay, it might get worse as you do the aligners. Or same thing with periodontal disease or gum disease. If you don't treat it before you start orthodontic, the aligners might actually make them worse by the end of it. So the treatment process for Invisalign is pretty straightforward. Initially, we'll get a digital impressions of your teeth, take some photos, and mainly just address your concerns. Mainly what you want to see change, what you prefer, and we'll work on the scan itself on the software, and then we'll get you back in 2 weeks' time just to see the final result. We'll let you know how long it's going to take, how many sets it's going to be, and see if you're happy with the final result. Once you're happy with that, we'll go ahead with the Invisalign, and that's when we start putting little attachments on the teeth, doing a bit of polishing if we need to, and we'll teach you how to use it and how to sort of have a good oral hygiene from there. So after doing Invisalign, there is a wide variety of options that we can do to improve the smile even more. So Invisalign provides a good foundation for the teeth to be in the position that we want them to be in. And we can do things like whitening to brighten the teeth up. We can do what we call an edge bonding, so basically putting little bits of filling at the edge of the teeth to trim them out, make them nice and smooth. Or alternatively, we've got veneers as well to put ceramic pieces over the teeth to change the color and the shape of the teeth altogether.